My name is Gorana Isailovic. I'm a medical doctor. As a dermatologist with more than 35 years of practice, I've been checked more than half of a million patients. From 1999, I'm working as a professor at Health College Belgrade, teaching future skin therapists and wellness therapists. From 2003, I have been teaching wellness programs, and from 2016, medical wellness trends and health tourism. From 2006, authentic Serbian wellness concept has been developed with its core elements: Raspberry Walk, ethno body art, ethno fitness, oat straw throne meditation, health garden, tea herbs from Serbian mythology, medieval finger food table. Following the experience of the first Serbian monastery hospital, founded from 1208 in Studenica, with its core cure elements, plants, and prayers. Following plants and prayers paradigm of medieval age in Serbian heritage, together with contemporary global wellness trend like Eric's nature, mindfulness, forest bathing, J wellness, research and development team of Medical Spa Association of Serbia with its daughter association Forest Therapy Serbia and Forest Therapy Southeastern Europe has been performed several projects to introduce Balkan Forest Hammam concept into health tourism offer in Serbia and Southeastern Europe. Almost 30% of Serbian land territory is covered with forest. Medieval travelogues describe green sea of Serbian forest. The central part of Serbia from where my family originates, Gots, is named Šumadija, that means forest land. My personal name, Gorana, means the girl from forest. According to the old Latin proverb that nomen est omen, I found as a goal in my life opportunity to bring to the people health and happiness through immersion in aromatic molecules, phytoncides, terpenes, limonens, pinens of Serbian forest, and to let them dive in Komorebi's scenery of Serbian beaches, mighty oaks, and gentle birches. Together with my team from 2013 up to now, I've presented or published a great amount of works, starting from Šumadija Forest Hammam and Kyoto 2014, 5 stars forest hammams of Serbia, at Mečevnik 2015, forest therapy potential of Mečevnik, Goč, Tara, Zlatibor, Fruška Gora, Divčibare. Through several projects supported by European Union like CrossSpa, Wellspring, Balkan Wellbeing, NATES, educated by Association of Nature and Forest Therapy California and INFOM Japan, participated in forest therapy workshops in Heringsdorf, Krems, and Berlin, presented out research at World Congress of Forest Medicine in Athens 2019, organized the first Shinderin Jokuš International Symposium in Belgrade and workshop at Obetska Svam 2016, organized the first International Health Tourism Workshop based on the forest medicine in Mimice, Croatia. There are several approaches or styles of forest therapy walk or forest wellness. The first and most contemporary is Muse, enjoying the forest atmosphere, doing nothing. After that, Shinrin Yoku, traditional forest bathing. Standard sequence as Association of Nature and Forest Therapy framework. Forest therapy with more fitness elements like in Germany and Austria. Forest therapy with more integrative medicine elements like in Asia. Balkan Spa Hammam with more sun, laughter, and joy. Forest diving in Slovenia and virtual forest walk during the COVID-19 pandemic. Healing activities of forest therapy are pluripotent, like room for listening, quiet presence, inquiry through all of 8 sensory modes we possess, connect with the nature with all senses being fully present in our bodies, slow down mindfully moving through landscape, and it is not trekking, it is not hiking, it is not walk with naturalist. Naming is not knowing in forest therapy. There is not physical exertion. The trail is up to 2.5 kilometers and duration is from 2 to 4 hours. Participants have to slow down and to open their emotional, physical, physiological, and spiritual being. Shinrin-yoku is practice like yoga, traditional Chinese medicine, Ayurveda, workout, prayers, or traditional medicine, so it has more effect when used with a guide. But remember that forest is the therapist and the guide is just opening the door. We can exchange health benefits with forest, other human beings, and more than a human world. We can find our sweet spot in the forest and start cross-species communication. The guide will invite you in very simple activities invitation that are SOS style, simple, open, and sensory. The standard sequence of association of nature and forest therapy is a kind of liminal journey in a fairy tale land from the threshold of connection to the threshold of incorporation. We are moving between the two archetypes, the tamed and the wild world, trying to contrast bodilessness and culture of anesthesia as a part of modern everyday life. The goal is experience of being alive, embodiment, to open our senses, vision, hearing, smelling, tasting, touching, internal body radar kinesthesia, interoception, intuition, and imaginal sense. Trials for forest therapy walk have to be certified for the participants to be safe and seen and for their needs to be met. We can perform forest therapy walk in a cure forest, healing forest, urban forest, or virtual forest. Apart from standard sequence invitation, introduction, emplacement, pleasure of the presence, what's in motion, and tea ceremony, in between we can perform dendrotherapy, landscape therapy, art from nature, gratitude, bibliotherapy with haiku poems, bibliotherapy with fairy tales, active imagination, floral mandala, sound therapy, dance therapy, grounding, tiger walk, feet in the creek, heliotherapy, color therapy, home pet therapy, herbal ball massage, sound ball massage, cosmic shower, hug the tree from Zen Qigong, philotherapy, hagiotherapy, laughter yoga, phytotherapy, aromatherapy, negative ion therapy, soundscape, myco-meditation, phenotherapy, mineral spring therapy, pelloid therapy, speleotherapy, soundscape, bird watching, forest to plate, harvesting, horticultural therapy, knitting yoga, body art, clay therapy, animation shower, play therapy, and at the end, the newest trend, forest theater, and doing nothing therapy, muse. According to our latest research, there is need for individual approach to the client of forest spa and health tourism consisted on the forest therapy programs. There is need for holistic approach to the client. Forest is the therapist, the guide opens the door. There is no need for superstar guide if he knows the language on invitation, SOS, simple, open, and sensory. The forest is panacea therapist. Forest cures depression and anxiety too. Structured forest therapy improves connection with other people and fight loneliness. Forest therapy is an excellent tool for developing creativity and team building. Participants are more relaxed and self-confident. Forest therapy has restorative effects. Forest therapy walk is a part of preventive medicine through health houses of health insurance companies. Forest therapy is part of health tourism programs as Eric's Nature. Our mental well-being testing instruments were Manchester Color Wheel Test, Short Warwick Edinburgh Mental Well-being Scale, Mandala-like Drawing, Aroma Diagnostic Test. What are prerequisites for forest therapy walk, forest wellness, and forest medicine? We should have a certified trail. We should have certified guide. And we just have to make sure that we have left our phone and camera behind, and we are going to be walking aimlessly and slowly. We don't need any devices. Let our body be our guide. Listen to where it wants to take you. Follow your nose and take your time. It doesn't matter if you don't get anywhere. You are not going anywhere. You are savoring the sounds, smells, and sights of nature and letting the forest in. And like Dr. King Lee, in his book The Art and Science of Forest Bathing says, let's go Shinrin-yoku, let's go to Balkan Forest Hammam, let's go to the Forest Theater, let's go to Musse. And there is a kanji symbol for Shinrin-yoku, consisted of 3 pictograms. The first one is the forest, the second one is connection, and the third one is luxury. Let's go to Balkan Forest Hammam.